local people. Important issues. CBS 10 WILM's weekly focus on the Lower Cape Fear region. This is Byline Wilmington with your host, Don Ansell.
Talking to you, speaking to you.
Well, while most of us were enjoying the holiday season, New Hanover County Commissioner Ted Davis found out that he would have to have and undergo emergency heart bypass surgery. Now, this is February, which is Heart Month. So this morning, Ted's here to tell his story along with the doctor, Howard F. Marks, the specialist who saved his life. So, Commissioner Davis.
Good morning, Don.
And Dr. Marks.
Morning.
Thank you for joining us on this almost end of Heart Month, but we got it in just before the end. Ted, I want you to walk us through like what happened before. How did you find out? What was the story there?
Basically, I've been having stress for a long time, and by stress I mean feeling like something is pressing up, against my chest. So
you having chest pains?
Not so much pains. And
pressure.
The more I kept going, it might end up in being with some pain. Then I started having what I call flutters. I would notice my heartbeat wasn't regular. It might just do a little funny thing and then get back into a normal rhythm. And then also at times it would just start racing.
And would you're saying to yourself, oh well, what were you thinking?
Well, I knew something was up, but I was exercising and just doing my normal routine with work. And quite frankly, it was my wife Jane that felt my heart one morning when it was racing, and she told me I really needed to go see a cardiologist. And of course, being hard-headed as I am, I said, no, I don't need that. That'd be a waste of time, and I don't need that sort of stuff. And bless her heart, she went ahead and made an appointment and made me go.
Is that called denial, Doc?
That's classic denial.
Is it? I've been there myself. You just don't want to. Did you go to Hank?
Not at first. What we did
Marks?
is I went to my cardiologist, and he wanted me to do a stress test, which I did, and that indicated that there was something that wasn't right. So then he wanted me to do a heart catheterization, where they go in and actually look.
And look and see.
Right, and that was done, and that's when I was told. That was done on a Wednesday morning.
All right, so, and I've had a heart catheterization, and for transparency, I've had a stent put in. I didn't have a heart attack, but I had an episode, they call it. But explain what that procedure is.
Well, I'll back up just a second.
Okay.
So I operated in the morning, and
so you did that procedure?
Not the stent. I had a routine day. I put in a heart valve in the morning. I was on call. Marty Conley, Dr. Conley called me after I got out of surgery and said, I'd like you to go by and see a patient that I just cathed.
So another doctor did the cath on him, right, and found the blockage.
Right. The cardiologists do the catheterizations, and in your case, did the stents. We, the cardiac surgeons, do the bypasses and the heart valves. And so Marty called me. I reviewed Ted's cath, and then I said, oh, that name sounds familiar, because Ted's a longtime friend and neighbor. And I walked in and I said, oh, that's why it sounded familiar.
It's the guy I know.
And he and Jane were sitting there.
They in your office, or they're in the hospital?
No, they were in the hospital just having had the cath.
I got you.
They call it the OPSU. It's the outpatient.
Right. Now, before we get into the procedure and what you do and that kind of thing, Ted's a guy that exercises, watches his weight. I've known him for years. He's a pretty moderate eater. What's the story there? Because it seems to be what they tell you to do to maintain good heart health.
Well, there are no guarantees in life. I will tell you that Ted is, if you look at a bell-shaped curve for risk factors, on one end, there's someone who does not smoke, who does not have high blood pressure, whose cholesterol is normal, and has no family history. And on the other end is a patient who has all those things. And
where was he?
He was on the left side of that curve. He had few risk factors. His risk factors were mostly, as I recall, family history.
Genetics.
Right. And the high blood pressure and the cholesterol.
You did have high blood pressure and high cholesterol.
But you have no smoking history.
No.
So you were right in the middle then.
Is there an average age where a bypass thing emerges, if it's going to? Or?
There is a median, which is in the mid-60s, but we operate on patients from their 30s to their 90s.
Wow, it's a pretty wide window. Is there any gender preference for that disease?
Males and I'll back up a little bit. We see the disease slightly more in males than females. It's the #1 killer of the highest risk factor for females of death.
It's the highest. That's
right.
With breast cancer and
ahead of breast cancer.
Uterine
right.
Right. Ahead of all that.
Yes.
Blockages of the heart.
Yes.
Wow.
Causing death.
Causing death.
Right.
But you do more men.
We operate on more men than women. And so again, I'd say to get back to risk factors, about 80 to 85% of our patients are smokers for coronary disease, and about 45% to 50% have diabetes.
And he was not a smoker.
And he did
not have diabetes. Could he have done
things.
anything to change the course of what happened?
Well, if we could look back 30 years and we could have meticulously followed blood pressure, meticulously
guided his diet.
And maybe taken statins, but 30 years ago we didn't have statins for high cholesterol. But the answer is that the family history, the high blood pressure, and the cholesterol were his risk factors.
I see. We're going to take a short break, and we'll come back. I'm so curious to what your reaction was, and the reaction of your family when you found out you had to undergo bypass surgery. Commissioner Ted Davis and thoracic specialist Dr. Hank Marks will be back with us. Stay with us.